I'm going to go to the page. Hi, everyone.
Hello.
Amy Raup here with Tracey Gartner tonight. We are super excited to have you all here. Hi, everyone. Sorry, I'm lower the volume on the other computer, making sure we're really live, and we are, so yay. Welcome to my monthly free Fertility Sessions webinar, where you get expert advice from women's health experts. Tonight, I am joined by Tracey Gartner, and we are going to be talking about a very important topic that has much more to do with your fertility and your ability to get and stay pregnant than you likely realize. Tracey and I was part of her, what was it, Fertility, Pregnancy, and Birth Summit.
Yes, that's correct.
And we did a conversation, we had a conversation and we got into the immune topic, and we both realized how passionate we were. So I chose her to do this topic with tonight because her education and her knowledge in this aspect of fertility is excellent. And, together, I think we'll bring a lot of good information to all of you. So those of you who don't know who I am, I'm Amy Raup. I'm an acupuncturist and Chinese herbalist by trade. I have written this book called Yes, You Can Get Pregnant. And I am on a mission to empower and educate as many women as I possibly can so that they can get and stay pregnant. And ultimately, the ability to get and stay pregnant comes from optimizing your health, and your fertility is an extension of your health. So that's why I host these monthly webinars, is to just share and collaborate with other experts in the field so we can bring you the best information that's available and help you as much as we can on your path to conception. And I'm going to turn it over to Tracey. I'll let her introduce herself.
Hi. So Tracey Gartner, naturopathic practitioner. I'm very passionate about fertility. I primarily do women's health, but fertility, pregnancy, and birth, and that postnatal phase are my favourite areas to treat, because to me that is true preventative medicine. So I help women overcome infertility and support them all through pregnancy, birthing, and that postnatal stage. Naturally, I treat children as well when you're doing a lot of fertility work, and I interestingly see a lot of post-menopausal stage as well, just with my knowledge in hormones as well. So
wonderful. And where are you practicing again? Tell us that.
So I'm in Australia. I'm practicing online, so I consult around the world, and also at Nourish in Dunsborough, Western Australia.
Wow. Okay, great. Okay, so let's get into it. We actually have quite a lot of questions, so I want to cover the material, and that way we have time at the end to get through all the questions. Keep an ear open, though, because chances are your question's going to be answered as we're going through. But so quick, let's get into, I think first maybe that we cover how immune system challenges actually can affect fertility. And, I can start and then I'll turn it over to Tracey, but when I was doing research for Yes, You Can Get Pregnant, and having, practiced helping women with their hormones and their health and fertility for 12 years now, I started to see this direct correlation between, what seemed to be an autoimmune component and this unexplained infertility. And then also in these women that have PCOS and endometriosis. And as I started to study more and more and look at the research, that the research is actually pointing us in the direction of understanding that both PCOS and endometriosis are actually autoimmune conditions. And so what autoimmune means is that the cells in your body are attacking So your immune system is set up so that it attacks a foreign invader. That's how it works. And all of a sudden, your immune system becomes dysregulated and starts attacking normal, healthy tissue for some unknown reason. And that can affect all sorts of organs and tissues in your body. When it comes to fertility, it seems to have a direct effect on, say, the uterine lining and how hospitable that uterine lining is, or how implantation can occur in there. It can affect egg quality because you can have antibodies basically to your ovaries. It can affect pregnancy because you can create antibodies to the embryo itself. You can have antibodies to sperm. And so the immune system is basically on hyper alert, if you will. The immune system is actually working perfectly fine. It's more that it's been set off, and now what used to be considered normal or acceptable in the body is now considered a foreign pathogen. And so the body attacks it and causes, a whole host of reactions, but generally speaking, a lot of inflammation in the body, and makes it less hospitable to a pregnancy, and to even balanced hormones, to a regular menstruation, to regular ovulation. So what I started to see was that if I treated most all of the patients, by helping them reduce inflammation in their body and improve the overall, quality of the cells in their body, that they were getting pregnant. And in turn, I saw symptoms that they would have that maybe have nothing in your mind to do with fertility, but things like allergies or eczema, psoriasis, gastrointestinal disorders, chronic yeast infections, you name it, you see all these symptoms start to dissipate. And so that would always tell me that I was then managing their immune system, and their body was becoming more hospitable and would hold a pregnancy. And so, Tracey, what do you want to add into that?
Yeah. I think the key here is looking at the general inflammation of the body. And what I often see is patients come to me with a raft of pathology tests, and nothing is really showing up. Of course, sometimes there is, yes. But what we need to do is to come back to treating the patient, not treating the pathology results, because they don't always align. Mm-hmm. So if you have a patient that comes to you with digestive complaints, as you said, allergies, maybe a thyroid condition, we really start to see that there is immune imbalances there, and it's stemming from inflammation. So I think it's just really important to have someone look at you very thoroughly, and be taking a very good medical history, case history, so we can get a really good idea of what's going on systemically, what's going on the whole body, and not just treat fertility. So we need to treat the whole person.
Yeah, I think that's right on. I try to get into that in my book, and of course in the clinic, I'm doing very detailed health histories, and I'm working on an e-course now for fertility, and that's basically what it's going to be, is helping people recognize and find what I'm calling the kinks in their system, right? And so to not focus so much on fertility, but to focus on health. And when health is in sync, to understand that then fertility will thrive as an extension of that. Mm-hmm. Because, like you said, right, I can think of one case right now in particular where she has really bad rosacea. And as an aside, has had, a handful of chemical pregnancies, which sucks. But until, my whole thing was, until I get the rosacea under control, do I really think pregnancy is going to stick, right? Because there's so much inflammation in the body. And curious enough, that patient actually, the first time she got pregnant, her first chemical, she broke out in hives throughout her entire body. And it was a full-on allergic reaction, basically, to the pregnancy. And I thought it was really interesting. She's working with a reproductive immunologist after a series of different doctors. And that's the first question he asked her. Did she have any kind of allergic reaction when she found out she was pregnant? Did anything interesting happen? Did you get itchy? And sure enough, she did. And that was the first chemical. That was the one that lasted the longest. And then then she had subsequent chemical pregnancies that lasted shorter and shorter duration because the immune system got stronger and stronger against the pregnancy.
Yeah.
Which is devastating. But now at least we have a doctor, you know, she has me on her team, and she has this great reproductive immunologist who together we're going to figure out this source of inflammation, treat it, right, and then allow her to get pregnant and stay pregnant. Whereas the standard Western medical doctor that she went to just completely blamed it on her age and poor egg quality, and didn't look any further, recommended, IVF with donor egg. That was basically the only option they were going to give her. And, bravo to her I pushed her in that direction, but for looking further and deeper and finding the right doctor to work with. But so when you work with patients, Tracey, how do you help them identify if possibly there is an autoimmune? I mean, you're a naturopath, so you can do bloods and things like that, correct?
Yes, correct. So I think, just as I said, it's great to be able to do lots of blood work, but I think it's always important to come back to the patient and what's going on for them, making sure that we are getting that digestion right, supporting the thyroid, making sure the adrenals are in tip-top shape. So this is, I think, the best way to identify if there is possibly an immune dysfunction going on for that patient. When you were talking about that sort of implantation, having night sweats is a good one to look out for, or a fever, a slight raise in body temperature. Because the body's seeing that as a foreign object in the body, and of course it is, but we want that immune system to shift correctly, because there is a shift at implantation and when pregnancy occurs, but we need that to happen naturally, and that's what's not going on for a lot of people that have the issue of immune dysfunction.
Right. And so, so I think, that's the general takeaway so far for all of you that are listening. If there's other health related issues that are going on, then your primary goal is to rectify those, and then understand that by doing that, you're going to lower the overall inflammation in your body. You're going to lower, the toxic load, say, on your liver, and you're going to make it easier for your body. Because the way I see it is when the body is so inflamed, and I'm sure you agree, Tracey, getting pregnant is not a priority at all. It's actually low on the priority list. Pregnancy is, how do I say it? Like our innate, we are born with the capabilities to get pregnant, but it is also a luxury to have it happen, in the sense of the body needs to be in that primed condition for it to say, yes, I can host another life, and I can do that because I have the resources and I feel, like it's a good environment to host that life. But for you all to take a step back and, rather than just doing something like Clomid to force an ovulation to then get pregnant, it's like we're really not treating the root of the problem, which is managing the inflammation. And still, I have girls that I'll work with, and we manage the inflammation great, and they still might need some reproductive techniques to help them get pregnant, some assistance. But I'd still prefer them to do the work to reduce the inflammation load on their body, and then go and pursue the fertility treatments, because you render better quality eggs and a better quality uterine environment, and therefore a better pregnancy for you and a healthier child in the long run.
Yeah, two things I wanted to say was probably nearly 50% of my patients, whether they're for fertility or not, are having digestive complaints. And with 70% of the immune system located in the gut, it's imperative that you get on top of those digestive complaints. So I think people also get so used to what's going on for them that they consider it normal. So we need to get that digestion back in track, which is, I think, imperative for fertility.
Absolutely.
Not only for conception, but for healthy pregnancy and for the health of that child.
Well, absolutely. I mean, Western medicine perspective, the immunity is in the gut, and in Chinese medicine, we say it a little differently, but I suppose it's the same thing of like, if you're not digesting your food properly, you can't absorb the nutrients to create qi,
Exactly.
blood that's necessary to create life, right? And so it's the same premise. So, even if you have a diagnosis of like PCOS or endometriosis, I'd actually bet that you also have some other health issues that are going on. And so,
absolutely.
Yeah, most of them, right? It's, I typically see, right, like an IBS like presentation with endometriosis. Polycystic tends to have, a lot of that hypoglycemia presentation. And so, same kind of thing, that we need to manage the digestive system so that you can rectify immune health. So then your body, you might still have PCOS or endometriosis, but it's affecting you on a much lower, grade, if you will.
Mm.
And what are some of the common things that you see with like endometriosis or PCOS in some of your clients?
And what do you mean, like symptoms or other conditions?
Sure, symptoms, yeah.
Yeah. Well, I must agree with you. Definitely digestive complaints with endo.
Yeah.
So I think endometriosis is very often underdiagnosed. So if a patient is having fertility issues as well as digestive complaints, I would thoroughly investigate endometriosis. And just to point out, endometriosis, we do need a hysteroscopy and endoscopy. It can't be diagnosed via an ultrasound. So that does mean surgery. I know it's invasive, but I think it may need to be rectified and through surgery, having that endometriosis removed, because that endometriosis tissue is then adding to that inflammatory condition that is already there. So it's a little bit cyclic in that condition. So
go ahead.
Yeah, I mean, with PCOS, often you're seeing that abdominal weight gain, acne. So yeah, that's, I think, the inflammation caused by insulin resistance there.
Yeah, absolutely.
I just wanted to go back before I forget. When you were talking about the reproductive technologies such as IUI or IVF, yeah, I think it's even more imperative, if you're going down that pathway, is to be addressing what's going on. Yes, you may need some assistance, but we need to be taking a step back and making sure that inflammation is under control, that the immune system is optimized. So we are optimizing the quality of the egg, that we are optimizing that implantation, because that implantation is an immunological reaction that's going on. So there is so much that we can do to assist. And I know acupuncture is one of the best things that you can do to help with that implantation, dealing with stress, the stress of IVF.
Yeah.
So
no, I think that's a great point. And yeah, often not looked at, right? I think when women get to that point, they think, oh, I'll just do IVF and get pregnant, versus, let's get to the root of the problem. Like you and I we're like detectives, right? We want to get to the root of the problem. I don't want to just Band-Aid it with, a medication to force them to grow more follicles, and then one to force them to ovulate, and then, progesterone to hold the pregnancy. It's so much more, I think complicated, is the right word. Miraculous, so much more than just that. And another thing, what you said about endometriosis and the surgery, I always say, I'm an acupuncturist by trade, and obviously I practice in alternative medicine, but if time is of the essence and getting pregnant is very important and you want it to happen soon, then going for a laparoscopic surgery to remove the endometrial tissue, I think, is one of the best options. You know, I always say to women, if you want to give me a year, you know, 9 months to a year, I could probably get rid of it through acupuncture, herbs, diet, lifestyle change, or you get the surgery and, you know, it's almost like a clean slate. And then we start fresh with all of our diet and lifestyle changes, the acupuncture, the herbs, right? And then we get pregnant naturally. And you know, I've had a couple girls right now in my practice that's exactly how it worked out, and it's been great. And they were also the habitual miscarriage types, right? Because there was so much endometriosis, there was so much inflammation that the body was rejecting the embryo, and or right, endometriosis and polycystic, because there's so much inflammation in the lower abdomen, in the reproductive area, that it really compromises blood flow to the ovaries, and that compromises blood flow to the follicles, and that compromises your egg quality. So it's, you know, one of the reproductive immunologists that I'm friendly with and highly respect, you know, he always says that if you see like a sudden drop in AMH or a sudden increase in FSH, that's very characteristic of endometriosis, you know, and that's another thing he looks for, that it's not age and you're not falling off like this fertile cliff like a lot of the traditional doctors will talk about, that it's really almost like the inflammation hit this tipping point and then all of a sudden your numbers go up or down. And, you know, he's in the same boat as I am, as I'm sure you are, that those numbers really don't mean anything. You know, it's more about quality, not quantity, you know. But I know all you guys out there trying to get pregnant, you hang a lot on those numbers because you almost want the permission to have the time, you know, and I really do think that you can buy yourself a lot of time, even just from going on an anti-inflammatory diet, if you will, from the sense that it helps also fight the aging process. So you're lowering oxidative stress, and you're actually rendering your cells younger than they were even, you know, 6 months ago. And so to understand that these processes can be reversed, they can be rectified, and you can ultimately really improve your health and your fertility. It just requires a commitment to, you know, taking care of yourself, right? And really tuning into your health and where it's at. And, you know, like digestive health, I think, is one of the most important pieces, especially with the potential for an autoimmune. Skin rashes are another really big one, you know, right? I always see eczema, psoriasis, hives, that type of thing is definitely, to me, a big indicator. If I see digestive issues and a skin issue together, I automatically just, you know, make sure thyroid antibodies get checked, right? And any other autoimmune markers. But even like you said, the bloods don't really mean that much to us. It's more about the presentation of the patient.
Yeah. Yeah, I just wanted to go back to the endometriosis and having surgery. You know, it really upsets me when women have had many surgeries and haven't really gotten to the crux of why they have the endometriosis in the first place. Yes, there may be a genetic predisposition, but your genes are not your destiny, and we can influence them by our environment. So I think it's a really good opportunity when you do get that diagnosis, is to actually work on the immune system, work on decreasing the inflammation, work on those factors that are causing that endometrium to grow unregulated. There was something else I wanted to say. I should really write notes so I can remember, but yeah, anyway, keep going.
It'll come back to you, right? Yeah, well, egg quality, I wonder if that was something you wanted to add to.
Yeah, it may have been. Yeah, I think it was actually, you know, around IVF and, you know, the opportunity to improve the blood flow. And yeah, again, talking about, you know, epigenetics and, you know, don't we want to be the healthiest version of ourselves? So, you know, when I have patients come to me, more often than not, they've got a lot going on, and it's not just to do with their fertility. you know, their menstrual cycles. So sometimes or very often I remind my patients, well, let's just really take a step back and just focus on getting you healthy, because you've got to carry that pregnancy. How healthy you are during your pregnancy is going to influence how you birth and are able to birth, birth outcomes, and it's going to influence the health of your child. So let's look at the larger picture and just get you as healthy as possible, and hopefully that fertility and getting pregnant will fall into place.
Yeah, that's exactly it. And you know, there's some new studies now too that show that the quality of the egg that creates the embryo impacts the health of the placenta, right? Which then nourishes the child, which is also very fascinating. You know, it's really, I always say I'm not really trying to get you pregnant. I'm trying to get you as healthy as you possibly can be, so that pregnancy happens, and that really ultimately you have a healthy pregnancy and you bring a healthy child into healthy home, right? So through all the work we do, that you're working on you and your health first, and then the pregnancy comes secondary to that. And listen, you know, there's the other side of the coin where there's plenty of unhealthy people that get pregnant all the time, right? And I think it's important to address, because I know most of our listeners are probably frustrated, right? You know, and just want to be pregnant already. And they've already been gluten-free and dairy-free and sugar-free. And, you know, and I do think, like, yes, that happens. And there's fertility, you know, happening all the time, and to people that maybe aren't in the best states of health. But to really then, you know, step back and you know, first and foremost, like, you are here. And I always believe that you're where you're supposed to be. And so you found us and you found this webinar for a reason. And this is the message you are meant to hear. But also to, you know, to step back and realize you don't want to just get pregnant, you know, or make it through that first trimester. Like, you really want to have a supremely healthy child and a really healthy pregnancy, because pregnancy can do a number on your body if you're not in great health, and sets you up for potential, you know, health problems in the future if you're not in the best state, and also birth outcomes. I mean, all of these things really play a significant role in the rest of your life. So I understand right now that it's almost tunnel vision. You know, I just want to get pregnant. Just tell me what to do, what supplements to take, and I will get pregnant, you know. And I know Tracey feels the same way. Like, I wish it was that easy, you know, but for every single person, it is different. And if I had a magic wand, none of you we wouldn't be having this webinar, basically, you know. You'd all be pregnant and have your babies already. But we are here, and every woman's level of inflammation is entirely different, right? So I think it's important to step back and assess your health. You know, how do I feel on a daily basis? What is my digestion like? What is my skin like? What are my hormones like? You know, and all of that, we want to see that fall into place and see your health thrive again. And then from that state is where pregnancy will happen. And you know, to just keep that in mind. It's like, sure, there are plenty of unhealthy women that get pregnant, but I don't think, you know, I think down the road that they're going to have their host of health issues. And so why don't we rectify our health now and understand, like, our genes are not our destiny. We can shift our epigenetics, and you can sure as hell improve the quality of your eggs and the quality of your internal environment, and understand that that's the best place to give birth from. Or to get pregnant from, right? Do you want to add something to that? Anything?
Yeah, I think it's important not to forget the males as well in this whole picture. Because 50% of that embryo is the male DNA. So recurring miscarriage, you know, 50% of known causes are due to males. So, and I think that's really important to stress, because so many women, and I think society, even women within society, sort of suggest that it is a female issue. So I think we need to think about the male issue here too. And in fact, when I take on patients for fertility, I see both the male and the female. I don't just treat the female. And if I do, I let them know that I'm not doing fertility work on them, that I'm doing hormonal work or whatever it might be with them. So I make it very clear that, yeah, it's just so imperative that the male is involved in this process too, and the level of inflammation that they have, that's affecting sperm quality, affecting DNA fragmentation and their epigenetics, how their genes are being expressed. So shall we talk a little bit more about what can be causing inflammation
Sure, go for it.
in the body? Yeah, so you know, there's so many things. I think in our environment today, we've just got so many stresses, so many that's disrupting that immune function, the thyroid, the adrenal glands. So yeah, decreasing stress, and stress isn't just psychological stress. Stress is anything that raises cortisol and adrenaline. So that can be infections, that can be toxins, that can be nutritional deficiencies, it can be working long hours. So we have so many stresses in our environment today. So I think that is having a huge impact on inflammation within our body.
Absolutely. And, so in addition, I think too, right, there's an interesting statistic that since the 1980s, we've introduced over 100,000 chemicals into our environment, and they are having a direct effect on, they're called endocrine disrupting chemicals. So they have a direct effect on hormone levels and imbalancing hormones, if you will, but also seem to have an effect on the immune system and exacerbating inflammation that way. So it's not so much even, just eliminating sugar from your diet, right? Or going on a cleanse of sorts. It's really understanding all of the stressors and how they're coming at you, and the chronic state of your fight or flight, right? If you're constantly feeling attacked by your world, and your workplace, you feel like that, and then your home life feels like that it's not a hospitable environment for you to get pregnant in. It's a highly inflammatory situation, and so to learn to manage that however you can, and meditation is obviously a great source of managing that, but also learning how to limit your exposure to such stressors, right?
Yeah, and I think one thing that I've learned through my journey is your thought patterns and belief systems and things like that. What are you saying in your head? That little voice, and just being really aware of that. So that can be, that negative self-talk really does impact us.
Well, it's interesting. I mean, I love that you bring it up. My next book is called Body Belief, and it's what I'm writing right now, and it's all about autoimmune conditions, but it's starting with teaching people how to acknowledge their beliefs, and then how to begin to reform them so they can renew their health. And it really is, it's so interesting. I'm kind of heavy in the research right now, but the biochemistry and the biology of belief is absolutely fascinating. So what we believe about our body actually dictates a physiological response. It's like thoughts are considered neurochemicals. They actually have such a significant influence on our cells, our physiology. And so, I mean, even in Yes, You Can Get Pregnant, the first chapter is about removing the I word from your vocabulary, that you're not allowed to use the word infertility anymore because it's such a negative word, and it implies that you're broken, right? Or that you're not fixable, that you're barren. And that's not the case at all, right? You maybe just have some fertility challenges, or you need some fertility rejuvenation, right? But that you are not broken. And then again, of course, to tune into that conversation, because what you say in the privacy of your own mind really matters. It really dictates your, of course, your beliefs come from that conversation, and then that conversation dictates your behaviors. And so So you and I could sit here and give, an entire diet to follow and, supplements to take and lifestyle modifications. But unless you truly believe that they're A, going to make a difference, or B, that you're worthy of feeling better, the chances are you're not going to stick to it anyway. And chances are too that you're, constantly in that state of stress because of the conversations you're having in your mind, that it's hard to manage the inflammation even, from that level, right?
Yeah. And I think actually just becoming aware of that voice. A lot of people actually aren't aware that they talk to themselves constantly all day. So I think that's the first step, is identifying that there is a voice talking to you.
Yeah, the consciousness, it's huge.
Yeah.
And then I think even taking that consciousness, like obviously the identification, and then when you start to tune in to that, conscious present moment awareness, that then you can take that into other parts of your life and think about, like, not only what you're eating, but what's the state you're in when you're eating, right? Are you eating really fast? Are you eating under the gun? Are you present or aware of, or even thinking about the nourishment that your food is providing to your body?
Yeah.
All of that really does play a big role. And I think, and you were talking about it before as well, but, fertility challenges for sure have a lot to do with, our environment and the chemicals we're exposed to, and then the pesticides in the food, and, the inflammatory grains that we're eating, and all of these things. But also there's, this disconnection, if you will. Like, so much of what is going on is that we're no longer tuned into our natural rhythm or the natural rhythms that surround us, right? We've been taken over by these computers that we're staring at right now, but there's so many, like, toxic influences, if you will, and to then learn how to disconnect some and reconnect to you. I mean, that's such a huge piece to all of this.
Yeah, and sometimes it's just a matter of to getting pregnant is actually having more sex.
I couldn't agree more. We'll talk about how that regulates the immune system.
How sex regulates the immune system.
Have you read that one study? I didn't mean to then put that on.
No.
Okay, well, so talk about more sex, and then I'll chime in.
Yeah. I just find that particularly the older couples that come to see me, sex drive has dropped. We're busy. Life is demanding these days. We've created a crazy little world that we live in, and I just find that couples just simply are not having enough sex. And studies show that younger couples are probably getting pregnant because they're actually just having sex more. Not necessarily due to egg quality that we've been led to believe. That that's the mantra of any fertility doctor is, it's your eggs, it's your eggs. Well, it could possibly be the quality of eggs, for sure, no doubt, but sometimes we just need to get back to the basics and make sure that you know exactly when you are ovulating.
Yeah, I agree. And so there was an interesting article in the New York Times based on a study. It was a small study, but it was showing that couples who have more sex get pregnant more often. And there was a theory that it's because it actually helps regulate the immune system, that the woman's body and the man's body are kind of more in sync with one another, and that the woman's body is more hospitable to the sperm because it doesn't seem like some kind of foreign object, if you will, like it sees it on a basis.
Yeah.
It was really interesting, but I couldn't agree more. Part of my homework that I give everyone is you have to be having sex 2 times a week, every week. And I also think that goes back to, this reconnecting, right, to ourselves and to our needs and to the intimacy in the home. Because if we're just having sex to conceive, I don't think anyone really feels good about that. Like, I feel like that's a lot of pressure on the situation. And so, how many times have you heard when, people weren't even trying, right? They were just having fun and they got pregnant. Or, I'm remembering one couple that went through rounds of fertility treatments, and I wish it's this easy for all of you. And then the last IVF didn't work and they said, screw it. They went to Vegas and got like really drunk and had sex in like a hotel bathroom or a restaurant bathroom or something. And they conceived. And that was that. It was that simple, but I know I'm being facetious, guys. I know that, you wish it was that easy, but just to really, tune into that as well, because, if we're talking about breaking the inflammatory, cycle in the body, right, and lowering inflammation, one of the best ways to do that is to break that stress cycle. And one of the best ways to do that is to have intimacy and fun with your partner, and, and the sex that comes from that. And so to, and I know that when you are deep in the fertility treatments, having sex to just have sex doesn't even seem like an option, right? There's a lot of tension and pressure around that, which is why, my recommendation is always we need to start having sex every week, and to, when we're trying naturally to talk less about ovulation with each other, keep the predictor kits, to yourself, or don't do them at all. If you see clear signs of ovulation, then just have more sex. In New York City, I see that all the time. Most women are just way too busy. Everybody gets home from work at like 9:30 and they're exhausted. They go to bed and they have to, schedule sex. And, and that's, that's not really where this is coming from, right? We're supposed to be having the intimacy and the fun to make a baby out of that, versus the forced, honey, I'm ovulating sex.
Yeah, and I think with PCOS, those women that are having irregular cycles, that the test kits don't confirm ovulation. So it may look like you tried to ovulate, so you may have had the fertile signs and you think, okay, well, we're done. We've had sex 3 times in a row. Why am I getting pregnant? Well, maybe you just didn't ovulate. So that's why having that regular sex all through the month, aiming for about 9 times a month. And I know that seems like such a stretch, but if you can do it and have fun and it be relaxing and intimate, I think it's imperative.
Well, and even it helps balance hormones, right? I mean, orgasms help with, balancing a woman's hormone, and just, the whole process.
Increased circulation to that reproductive area is really important for healing, for implantation, so to deliver nutrients to the endometrium and ovaries. So and if you're not orgasming, then that is telling me that you've got an immune imbalance, which so we need a proper parasympathetic and sympathetic nervous system to be in balance, otherwise you won't orgasm. So that is then telling me a little bit further that, okay, stress is really impacting what's going on. So stress is going to be inflammatory if you've got stress, and it's going to impact your the development and production of your sex hormones. Wow. Because the cortisol and adrenaline are made over the production of progesterone, estrogen, and testosterone, because in a stressed state, it's not important to reproduce. So if we're constantly having stresses, we're not going to have nice, balanced hormones.
Yeah, agreed. I'm going to jump into some of the questions, only because there's so many and they keep rolling in. So I think we should.
How much time do we have?
Yeah, probably about another 20 minutes or so. But so here's a question, and you might have more here than I do on this one. Infrared saunas for detoxification, along with frequency and duration. And is this safe in preparing for pregnancy and during pregnancy? Do you have any opinion there?
Yeah, definitely. Would not be doing it post-ovulation. It is a good tool for detoxification, certainly. Good for those that might have hidden infections, chronic infections are going to cause inflammation and immune dysfunction. So yeah, highly recommend them, but just not post ovulation. So if you are trying to conceive every month, just do it in that first half of the cycle.
Yeah, agreed. And then what about, I don't know if you have something to say, I'll add to intermittent fasting, and is it beneficial for preparing for pregnancy?
Yeah. I think if PCOS, if you've got abdominal weight, even if you don't have a diagnosis of polycystic ovaries, then yeah, intermittent fasting. I often suggest it's not really cheating, but having at least 12 hours between meals. So if you have dinner at 7 p.m. at night, don't eat breakfast until 7 a.m. So that's just giving your body the enough time to rest and digest. But yeah, the intermittent fasting is very proven for insulin resistance, and insulin is so inflammatory, and insulin is going to affect egg quality. So there has been a study done on metformin, which is often used in PCOS, that it helps with longevity. It helps with
interesting.
Yeah, cell health. So yeah, what would I be using? I'd be using inositol. Inositol helps balance the insulin, and surprisingly, it helps with egg quality as well.
Right.
Not surprisingly.
Yeah, I like the ovasitol, right? The powder, and I think that's the two different inositols in there. That seems to work really well for the PCOS. So are you saying intermittent fasting for PCOS, or are you saying in general?
Well, I don't see it being absolutely necessary for everyone. Right. And it's not something that I prescribe, but I do let patients know that I prefer them to have 12 hours between eating. So yeah, I think it could be very beneficial for someone with PCOS to help balance that insulin. But you also need to be careful that people that do have that blood sugar dysregulation don't do well with fasting. So if you're not doing well, such as you get irritable without eating, you get that fuzzy brain, that you're getting lightheaded, I would be suggesting regular meals with protein, fat and fiber in every meal. And I suggest no grains, 0 grains.
Same, yeah. Absolutely the same. Yeah, because often I'll say to be eating protein, and fat every 2 to 3 hours, and to not go too long. But the intermittent fasting is interesting because there are some who can tolerate that better than others, and typically if they're on inositol too, right?
Yeah.
So I mean, the bottom line to that answer too is you have to see what works for your body and how you feel.
Absolutely.
If you feel worse, that's not for you. And if you feel better, then that's for you, right? And this is all coming back to us not having blanket recommendations, but rather you tuning into your body and seeing how you feel.
Absolutely. And I'm glad you brought that up, because I think people fall into the trap of trying to treat themselves, and there's just one blanket approach to that particular condition. We don't treat the condition, we treat the person, and we treat the symptoms that they're expressing. And it's really imperative. Yes, I do have general recommendations, but I really work with the patient and make sure that what we're doing is suited to them.
Perfect. I agree. Couldn't agree more. Next question. I am recently pregnant. Congratulations. 5 weeks and 5 days. The last week, having some dark brown spotting. Went to the doctor, HCG and progesterone checked, and early ultrasound done to see the sac. So it's her second pregnancy, but she lost the first one. have you treated many patients with this issue? I'm looking for any advice while I wait for my 7-week ultrasound next Tuesday. I mean, other than I would rest and take care of your body, and you know, you could try and get in for a 6-week, you know, just to make sure, at least blood work to make sure that the beta and the progesterone both still check out, and even look to your doctor for some progesterone supplementation possibly. But the truth is time is probably the biggest teller here for us. And you know, but I would try to get in again at the 6-week, and just to make sure that you see numbers rising and that everything still looks like it's healthily developing, just more for your state of mind, because I'm sure you're going to be very stressed about this. Do you have anything to add in there?
Yeah, I think it's hard to say too much without knowing her history and her full history. So yeah, definitely progesterone could be a good one to just go on. But yeah, I would also get thyroid checked as well.
Yeah. Thank you. Very good point. Yeah, to make sure, right, that the TSH is between a 1 and a 2, and yeah, and if not, to, you know, to have them manage that immediately, because that can help.
Yeah, I'd be getting antibodies tested, as well as the T3, free T3 and free T4. But you know, spotting doesn't necessarily mean it's going to be miscarriage. I know it's a stressful situation. So yeah, I can't really say much more because we don't know the history of the patient.
Same. But yeah, like Tracey said, it could be totally normal, and I hope that it is. But I would still urge your doctors to test for all that, and if it does wind up that, you know, things don't work out, then for sure you need the full thyroid panel, like Tracey was saying, the antibodies, the TSH, the free T3 and T4, and even looking into the MTHFR and, you know, any potential blood clotting disorders. Yeah. But okay, so next question. I have celiac disease, was diagnosed 2 years ago. Been trying to conceive for 3 years. So still no luck on the baby side. What advice, tips, information can you tell me in my case? I'm 26, my husband is 33. I'm overweight and been overweight my whole life. Stopped eating dairy, just quit smoking, HSG. So, I mean, I think kind of what we've already been talking about, you know, for sure, I would be 100% gluten-free if you have celiac disease, because if you're exposing yourself to gluten and you're already known to be allergic to it, that's setting off that inflammatory response, and pregnancy, it's very hard for pregnancy to happen. So 100% gluten-free. I would also do dairy-free, sugar-free, you know, soy-free, everything free. And for sure with the quitting smoking, I mean, bravo, but that was 3 months ago. So I think only now are you really heading into where the egg quality is going to start to improve from the harm that the cigarette smoke has done. And so, yeah, she was talking about quitting smoking and trying Clomid. The doctor advised I'd wait 2 months until after quitting smoking. Yeah, I would, you know, you're young, 26 is young. I would give yourself 6 to 9 months of really following, you know, either the diet I have laid out in my book, Yes, You Can Get Pregnant, being off cigarettes, if you're overweight, trying to get back into like a healthy BMI range, and giving your body time to reduce the inflammation, heal from, you know, both the celiac and the, you know, heal from the inflammation, I should say, from the celiac and from the smoking, and give yourself an opportunity to get pregnant naturally, because it, you know, it could happen. But either way, you don't want to just rush to the Clomid thing, because we don't know about the quality of the eggs that you could then get pregnant with, or the embryo that you could create.
Yeah.
Yeah.
Yeah, so I would agree with you, Amy, that absolutely 100% gluten-free. Um, so the having been celiac um, and have been eating gluten, she would be having a lot of nutritional deficiencies. There'd be a lot of inflammation in that gut left over from, you know, the actual autoimmune condition that celiac is. So we need time to repair that gut lining. So I'd be doing a lot of gut work there. And it can also affect the eustachian tube, not the eustachian tubes, that's the ear, the fallopian tubes. So wrong end of body. So I also think that yeah, having only quit smoking just recently, a lot of toxins, so many toxins. So that's going to need time to remove from the body. So I'd be doing some liver support to remove that. You know, the infrared saunas would be good here. Lots of exercise to remove toxins from the lungs and sweating there. Weight loss as well. The weight is going to be inflammatory and affect egg quality. So I think it is early days. Again, taking a step back and let's get you as healthy as possible. So, well, hopefully that you don't express that gene of celiac to your offspring, and, you know, looking at the epigenetic component of that there. So yeah, I know it's hard when you just want to have a baby and you're ready for it, but yeah, if you can just focus on yourself, that outcome hopefully at her age should be able to fall pregnant quite easily and won't need the Clomid.
And more than once, you know. I'll keep it on you. How about enzymes like wobenzyme help with conception and implantation if there are autoimmune issues? And is it safe for pregnancy?
What enzymes were they?
Wobenzyme, do you know that supplement? They're basically proteolytic enzymes.
Yeah. Well, having proper digestion decreases inflammation. So systemically, so yeah.
Absolutely, I agree. Yeah, if there's inflammation, and again, you know, see how you respond to it. But it is typically something I'll suggest to help, especially if there's fibroids or cysts. You know, it seems to really help kind of break up congestion in the body. Let me get to some more questions. Sorry. Okay, here's another one. My acupuncturist said my liver and kidneys were toxic, so he put me on Chinese herbs for 1 month. He said, so we're studying fertility acupuncture. He wanted to clean out those toxins. Is that okay? The first week I had blood in my stool, so I'm only taking the herbs at night. I'm feeling better now on week 4 of the herbs. What do you think about facials once a month and salicylic acid and glycopeels? I have acne, especially since I went gluten and caffeine free. These herbs I started breaking out. I'm 42, still breaking out. Should I stop the facials? Yeah, you know, I don't know the exact herbs that he has you on, and I don't know your exact case, so I can't say whether or not to continue them, but for sure, make sure he understands that you had some blood in your stool, as I think that's somewhat alarming. If it's bright red blood, less alarming than something that looks like coffee grinds. But the facials, the salicylic acid, and the glycolic peels, I think is a bit aggressive and not sure of any of the chemicals that you are exposing your body to undergoing those. And the acne is a sign that there's inflammation in your body. So I think you should continue to work on, you know, keeping the diet really clean, gluten, caffeine, dairy, look to soy, make sure you're not eating soy. I would look to the changes in your lifestyle to make sure the acne goes away, rather than doing, the facials and the peels are really just a Band-Aid treatment. They're not treating the root of the inflammation that is expressing itself in acne. And then she goes on, I've cleaned out my shampoo and makeup to only mineral makeup. I just ordered my facial cleanser. Thank you. Let's see, any tips on which ones to use first? I would try the balancing oil. That's going to be the best for acne prone skin, and the cleanser. What do you think about dyeing my hair and highlights? What do you think about hair dye and pregnancy?
Avoid it if possible. Highlights, because it's not actually touching the scalp, not so bad. Just the fumes. So, wearing a mask whilst you're at the hairdressers. So there's some natural alternatives for hair dyes, but reducing toxic load, preconception as much as possible. There just really isn't a need for toxic chemicals these days, because there's so many wonderful natural products available.
Yeah, agreed.
I just wanted to comment on the acne. If the liver and if the body is toxic, the liver and the kidneys are going to be under strain, because they're sources of detoxification and elimination, but so is your skin. So the skin is one of your major detoxifying organs, and so her skin is showing that strain, that she's still a fair bit toxic. It also could mean that she's got hormonal imbalances, which we need to be asking, why is there hormonal imbalances? Hormones are responders, they're not the cause. And possible polycystic. It's hard to know. If it's just recently, it's probably just her body out of balance and dealing with all those toxins. But if she's always had that acne, I'd be considering polycystic as well.
Yeah, I think that's a great point. Thank you. I'll leave it on you, and I'll read you the question. Could I have endometriosis even though I no longer have painful periods? Should I go back to my OB to check for endometriosis or hormones for low progesterone? So a history of painful periods, acupuncture helped. However, we've been having unprotected sex for 2 years and trying to conceive for over a year and no pregnancy. Diagnosis of fibroids. And then, do you recommend Qigong? But with the fibroids and a possible history or wondering about endometriosis.
Yeah. Well, again, not knowing much about her history with the endometriosis there, but the fact that she does have fibroids, inflammation, immune dysfunction, hormonal imbalances. Some blood work could be important here to see where her hormones are at, but just doing a very thorough case history and looking at the signs and symptoms usually gives a good indication of whether you've got too much estrogen or too little progesterone, which is often the scenario in endometriosis and fibroids there. I think possibly, yes, some further investigation is warranted with her history. Was there any other questions she had?
Just should I have my doctor test me for endometriosis? And then, do you recommend Qigong to your trying to conceive patients? Which I don't know if you do much Qigong recommendation. That's probably more a Chinese medicine thing, but
I don't actually, but I've got nothing against it. I think I have heard it's absolutely amazing. I've never had any experience myself.
Yeah, it's fun. It really is. But quickly too about this case, I would say too to look to your diet. What is your digestion like? If you are having digestive issues, then I would work on eliminating the inflammatory foods in your diet to see how that changes your presentation, your state of health. See what else is going on. And if anything, you can make that fibroid smaller and reduce inflammation in your body. And as far as Qigong, I absolutely love it. I have a bunch of Qigong exercises in my book and for different phases of your cycle. So you could check that out. There's some great videos on YouTube. And what role it plays in trying to conceive. Qi is basically, the translation is the life force, and Gong means breath. So it's basically like you're creating life force through your breath and through movement of breath, and great for improving circulation and blood flow throughout the body, and cultivating fresh, healthy Qi, which is what we want to be circulating in order for health to thrive and for conception to happen.
Yeah, I do think it's imperative that we do have some sort of exercise that is downtime, meditation, yoga, things like Qigong, as part of our everyday protocol.
Yeah, that is the best anti-inflammatory medicine out there.
Yeah, and I just wanted to just go back to the digestion you pointed out, getting on top of that with endometriosis. If she is experiencing maybe some IBS type symptoms, that could be a sign that her endometriosis has come back. You don't have to have pain to have endometriosis. So I think that's why a lot of women do get underdiagnosed, because they think, well, if you don't necessarily have those actual painful periods, then you don't necessarily get further investigation. But yes, IBS can mean that you've got endometriosis.
Yeah, great.
IBS symptoms, sorry. Yeah.
And then another question, is lavender safe to use applied to the skin, and also drinking in tea? I used to love it for relaxation. I think lavender, I wouldn't do it orally if I was trying to conceive. In diluted forms applied to the skin, I think it'd be fine, but I do know it has some estrogenic activity, and I'm sure online you can find pros and cons, or people supporting either side of it, but I would be careful with ingesting it, and maybe use it, put it in a diffuser, and you can inhale it, that kind of thing, in your room. Or dilute it like 1 drop to a couple ounces of a carrier oil and use it that way on your body. Anything to add there?
Essential oil ingested is contraindicated in pregnancy, first trimester. There are other safe, beautiful herbs that you can be using to relax the nervous system, so I'd be using those instead. But topically, I don't see an issue. If you've had recurrent miscarriage, maybe you just want to be a little bit more careful than others. But I do believe that most essential oils, in the vapor or topically, are completely safe in pregnancy. But I wouldn't ingest it, no.
Same, yeah, I agree. I did a bunch of research when I created my skincare line on, what was fertility safe, and most all of them actually are. In minor, in the way they're diluted and topically applied. It really is the oral ingestion, which I know some of the companies like doTERRA and Young Living recommend, and I don't recommend really ingesting the essential oils, especially without knowing the chemistry. And then this is a question: when I have an orgasm, I splash. Will this push or flush the sperm out? I'm not quite sure what a splash means. I'm assuming that just means a spraying, right, that some women have. And I would say no, absolutely not. The projectile force with which sperm comes out of the penis is, I forget, but it's very aggressive. Like, they really can get through and up pretty much anything. So obviously you want the mucus to be fertile to accept it, but no, I wouldn't think that has anything to do with pushing the sperm out. Anything to add there to that one, Tracey?
As long as the penis is high up in the vagina, that the cervix actually would sit lower than where the penis is anyway. So if the fluid is coming out of the cervix, then they're bypassing each other. And maybe she's talking about release of urine, which can happen during orgasm as well, which is completely different. So
Right.
they're not going to interfere with each other. Yeah, just to make sure that penis is high up in the vagina at ejaculation.
Here's a question. I'm 40 and would like to conceive again. I've had multiple chemical pregnancies. What is the one thing you would suggest I do to make a pregnancy stick?
Yeah, I guess with chemical pregnancies, it depends how far along she's getting, whether it's, you know, just to the 4 weeks or whether it's 5 weeks. But so many women do actually have chemical pregnancies. It's just that if you're not trying to get pregnant, you wouldn't be testing.
Right, you wouldn't know. Yeah.
No. So she could be still in the normal range without knowing more about her.
Mm-hmm.
Yeah, it is quite common to be having chemical pregnancies. So if she was, yeah, it's hard to say. But, you know, we need to look at the whole person. We need to look at what's going on for her partner, what's going on for her, and treat the whole person, not just her fertility. Improving egg quality and sperm quality, that's their cells. So if we can improve our overall health, you know, the sperm and the egg are just another cell. Well, I shouldn't say just another cell, but
they are basically. They're just in a different. They just had a different like stem cell origination, but they are. You know, I agree. It is all about cellular health. You know, and you don't just localize like taking, you know, maca or royal jelly isn't just going to localize in, you know, the uterus or the ovaries, right? It's about improving the overall quality of your physiology, and that's every single cell in your body. And that's I think the biggest differentiation, right, between Western medicine and any alternative medicines is that they compartmentalize. You know, fertility's down here and it has everything to do with just down there, and we're looking at the whole system. So again, that question, yeah, it's the same thing of really getting into optimal health and see what else is going on in your system. And then pregnancy should work itself out. And I don't think 40 is too old by any means, you know. And there's very little research to show otherwise. So I think we'll focus on your health and feeling good, and let's see what comes of it.
Yeah, for certain. And I think that maybe she needs someone to support her. Make sure, you know, she is at an age where time isn't on her side. That don't try and do it on your own. Get someone that can support you. And, you know, we're trained to identify what's going on and how to improve. And, yeah, we do need to treat the whole person and not just focus on that fertility.
Yeah, bravo. Great question. And let's see. Okay. One last question. Can continuous light pink spotting for over 2 months be a result of an autoimmune issue? That, you know, I don't think there's enough information, but yeah,
I'm not sure. Does that mean she's pregnant, or does that mean just not having regular cycles?
Yeah, I think already dairy and gluten-free, also on the mainly protein diet, but it's just continuous light pink spotting. So yeah, that's all it is. That's all she wrote. Yeah, I don't think there's enough information. You probably should just go to your gynecologist and get checked out. You know, there could be like a polyp on your cervix or something like that going on. But also, like, are you regularly menstruating and the spotting's happening in between? Is there no menstruation and just spotting? Could you be pregnant? You know, those are types of things that I would look into, but I don't think spotting doesn't necessarily indicate autoimmune. It might indicate some inflammation, right? But yeah, we'd need a lot more information than that.
Yeah, I totally agree. You don't have enough information. And if you want to send me an email, I can answer that question for you. But yeah, Tracey Gartner at outlook.com.
Oh, you're wonderful. That's great. I love it. And then there's just a few more online. Is there anything else you would recommend to lower prolactin levels besides Vitex, acupuncture, gluten, dairy-free diet? What do you think?
Vitamin B6
Yeah.
can be helpful, and regulating insulin as well.
Yeah.
She's on a gluten-free diet. So, yeah, making sure that you're getting rid of those grains. The grains stimulate the insulin more than anything. So,
yeah, and just, heavy on the fats and the protein, and, lower on the inflammatory substances. Is spearmint and raspberry leaf good for PCOS? Again, I don't think there's enough information. It's a very general statement, right? Raspberry leaf has some ability to contract the uterus, so I don't usually like to recommend that once you could potentially be pregnant. I don't think they can necessarily hurt the situation, but I think there's, it's more about, controlling the insulin resistance and regulating blood sugar than it is about taking the tea, so to really do all those things that you can do in that regard.
Yeah. I just don't think that they're not my first herbs that I would use anyway, and I'd never actually heard them being used personally, but yeah, you need to look at the whole body. Again, I know I'm repeating myself, but that, yeah, you really need to regulate that that insulin, and then the hormones will all start to come back into balance. We need to decrease that inflammation. So, not to repeat myself, but everything that we've discussed today.
Yeah, agreed. Okay. And let's see, how to increase egg count and egg quality. I mean, I really think this is, the stuff that we've been talking about. And again, it may appear to you that we're being overly general, but we're really not. That the root of optimizing health and fertility and improving egg quality, or, egg count, I'm not sure we can do much about. There's some argument that we continue to make some eggs, but for the most part, we're born with how many we have. But really all that matters is quality, and that's just not egg quality, that's the quality of every cell in your body, and it's the quality of your health. And so that's really what the bigger picture needs to be focused on, is that you need to get as healthy, and I say that in a loving way, sorry, not like you need to get, but improving your health is going to do wonders for your fertility. Sort of continue to focus on, your digestion and your immune system and things of that nature, and finding a place and a rhythm for your body where you feel your healthiest, and then you will see things like egg quality improve. It's it is kind of that simple and that general, if you will.
Yeah, I think I'm wondering whether she's referring to her AMH levels. Probably, and whether they're low.
AMH or FSH, right?
Yeah, it's not an indicator of your ability to conceive. I know I very often get women asking me, oh, what does this mean? I've got a low AMH. Is my ovarian reserve? Well, no, that it doesn't really give us an indication of whether you can conceive or not. So, but what we don't know is the quality, and that's the most important. So, just, take a look at your health, and how is your digestion? Are you going to the toilet every single day? Are you having a nice healthy stool without straining? Is it well formed? Do you have any skin complaints, acne, pimples, eczema? What's your stress levels like? What's your sleep like? That's a really good indicator. Are you getting really good 7-8 hours of solid sleep without being woken? So just take a step back and just make sure that you're focusing on every areas of your health, and that's going to optimize egg quality as much as possible.
Lovely. Okay, I think those are all our questions, and we're a little over, so I'm going to let our viewers go and let us go. But, I'll let Tracey say her goodbyes, and, as well, remind you that I will follow up with an email to all of you tomorrow with this recording. We are only going to keep it live on YouTube for about 2 days, so if you want to watch it again, make sure you do so in that period of time. Otherwise, I'll send you a link to where you can purchase it for viewing after that. And in the email, I'll have my information and Tracey's information, so you can reach out to us and with any other questions or ask how you can work with us. And we'd love to continue to help you on your path. And of course, I'd love feedback and any topics or fertility related conversations you'd like me to host on these webinars. I'd love the feedback and your guidance. I'd love to help you however I can. So have a wonderful night, and thank you. And I'll let Tracey say her goodbyes.
Yeah, well, thank you for having me, Amy.
Oh, you're welcome.
Oh, thank you. And yeah, thanks for listening, everyone. I just do hope that you got lots out of listening today, and do shoot me an email if you've got any questions. One thing that I see often is people are trying to do this on their own. And unfortunately for some, fertility is quite complex. And I know it's painful when you see friends get pregnant just really easy, but everyone has their predisposition to health issues. So, do reach out to us, Amy or myself. We are here to help, and we have lots of experience in identifying what's going on for you and supporting and coaching you through that. I just hate it when I see people just even stumbling through some really simple issues with fertility, and they just have tried to do it on their own for too long. So we are here to help. Yeah. Also check out, I did a fertility, pregnancy and birth summit. That is still up, but I don't know how much longer it is going to be up. I've got a few interviews there for you to check out. And you can reach out to me via email, and I'm just in the midst of getting a website up. I have previously never needed a website, but I'm getting up with technology and the times. So you'll find me at www.traceygartner.com. So
great. I'll send all that out tomorrow, and then I can also include a link to the summit, because that was great. Okay. I was a part of that summit and I loved it. Yes. It was so wonderful. And another thing too I'll include is I do have a secret Facebook group for women trying to conceive. And so what I'll do in the follow-up email tomorrow is include information for you if anybody wants to join, because it is really important. Like Tracey was saying, so many times, it's so important to have support on this path. And, I have doctors or office hours on the Facebook page. So I come in, chime in and answer questions. And what I love the most is seeing all of you support one another, cheering each other on for IUIs or giving advice. And it's really a nice, wonderful space that we're holding that I'm holding for you guys. And I love it. So I'd encourage, if anyone's looking for more support, and it's, support the way I bring it on. It's more positive than, solution focused, not problem focused. And so if that sounds right for you, then I'll include a link in tomorrow's email, and you can sign up with us. But for now, we will say good night, and thank you all again so much for being here. And I hope you feel empowered and have more information to optimize your health so you can get pregnant faster. Have a great night.
Bye.
Bye.